I have to give a shout out to our home state, New Jersey, where all of the magnet hospitals came together and said they were going to support the state implementation plans. Now, why is that important? Number one, it's the hospitals that are most revered in the state, the ones that do the best job of delivering high quality care and making the environment good for nurses. And they are saying, we're willing to put our money where our mouth is. In some ways, it doesn't matter how much money. It is the fact that they are the ambassadors for what needs to go forward. And that is a huge message. So that's one example. And then I go to Texas. And you've been told, you told me, don't mess with Texas, right? There you go. A partnership that involves physicians. We were talking about how physicians are sometimes not as friendly. Economists, building the evidence. When you've got an economist who's working in your strategic alliance, you can really start to tell the numbers story. But then also business leaders, leaders from tech companies, computer companies, and helicopter companies. When you get that kind of a coalition coming together and saying, you know what, we can solve the problems in a way that is uniquely possible in Texas, that to me is the kind of change that really invigorates me. And then, you know, we have states like Nebraska and Maryland who are looking for their own special ways to deal with the problem. So to me, what is energizing me is that all of you are here, all 50 states and the District of Columbia, and that all of you know what needs to be done in your state, and you have the power to find those solutions. That's what really energizes me.
There is a degree, though, as in any big challenge, of risk. And this is one that RWJF is taking on, but why? Why are you so deeply committed to this? And when, you know, it could go either way, different direction.
You know, I look at it this way. We can't afford not to do this as a country. I referenced earlier the fact that we are becoming a more diverse society. We have more people who need coverage, but also we have more people who need to live a healthier life. And we know that that can only happen if we invest in our communities and in our healthcare system.